Hi, I'm Dr. Lakshyan Schanzer, and I am a licensed psychologist in Rhode Island and Massachusetts. And I have a private practice in psychotherapy and yoga studio in Cranston called Body Mind Therapy. I've been teaching and practicing yoga and meditation for nearly 50 years and practicing psychotherapy for almost as long. Um, I mostly work with individuals and couples, whether it's yoga or psychotherapy or presenting at professional conferences or training of therapists or offering mindfulness programs for businesses. All of my work involves the integration of the best of Eastern and Western approaches to psychotherapy. Um, Most of my clients have your garden variety of suffering, and that includes loss, grief, depression, anxiety, trauma, and just the consequences of ordinary life. My work often resembles other kinds of traditional therapies that include Rogerian non-directive psychotherapy, cognitive behavior therapy, Gestalt, bioenergetics, and even family systems work. And so I think if I give you a little description about what my interests and curiosities have been, it'll give a little bit of a view about the nature of my work, which I'll also present in a little bit. So as a child, I was pretty curious. I was pretty curious about the interesting shift that would take place from waking to dreaming and back again. So as a little kid, I would sit by the side of my bed and try to see whether I could actually sit up and go back to the dream I had, and then come back to being wakeful and back and forth again. I was also interested in and cultivated the kind of quiet, relaxed focus that would come from long walks, long distance running, long distance bike riding, repetitive physical activities. And I also noticed that when I would focus intensely on something like reading a book or playing music, I found that my sense of time would shift kind of easily. So with one kind of focus, it would seem like hours had gone by when it was only a few minutes. I would get lots of rest from just a few minutes of a break. Or the reverse was true. If I had hours go by and I was intensely focused, it would feel like just a few minutes had passed. And so for me, as a kid, long before I was introduced to yoga and meditation, I was always kind of interested in these kinds of events that would take place in me. And I think for a lot of children having the same kind of interests. And I just had it as my own particular personal hobby. And then in the 60s, I had the good fortune of meeting and studying with a number of really incredible yoga and meditation masters. And these include Swami Satchidananda, who was the opener of the Woodstock Festival and the founder of Integral Yoga. And I was invited personally by B.K.S. Iyengar to take his teacher training with him in India in 1978-79. And probably most importantly was the opportunity I had to sit with Nisargadatta Maharaj, who is a pretty well-known jnana yogi, but mostly well-known in Buddhist meditation circles. So I had the good fortune of immersing myself in disciplines that were actually very systematic and structured towards the same kinds of things that I had curiosity in. And as I deepened my practice, and particularly my teaching, I noticed that I had all kinds of insights and emotional releases, memories, and wonderful feelings of well-being as a result of my practice. And it was the same for my students, given the method I was developing. And I realized that actually the results that I was getting had more to do with psychotherapy than becoming a yoga master sitting in an ashram. So I decided I needed to learn more about psychotherapy, and I did. I had, again, the good fortune of being in the right place at the right time and had wonderful teachers. I got a master's in counseling and then many years a doctorate in professional psychology. So you can see that my interests and background really are a kind of coalescence of Eastern and Western techniques of psychotherapy. The method that I use can actually be described by the 5 fingers of your hand. The first one, and most important one, will be the thumb, which I call mindfulness or the meditative state. The wonderful thing about this particular digit is that it helps us grasp. It potentiates what every one of the other fingers can do. And in fact, biologically speaking, the advancement of our species, the encouragement of a larger brain, is all connected with the development of being able to use this ability to grasp. In fact, the English word intelligence comes from the Latin word intelligo, which means I grasp. So from my point of view, the meditative state essentially is the potentiating factor in making good psychotherapy happen. Let me tell you a little bit about what I mean by a meditative state. First of all, it's built in. So while I actually teach and encourage people to develop meditative practices, the truth is the meditative state is something that's already available to you. It's part of your whole body-mind being. So let me give you a little teaching exercise for a moment. What I'd like you to do is close your eyes, maybe for about 5 or 10 seconds. And you'll notice that as soon as you do this, your whole ground base of your sense of reference includes more and more of your internal being. You can open your eyes. The reason why the shift takes place is because as soon as you close your eyes, the visual centers in the back of the brain go into a default brainwave rhythm, which is called alpha rhythm, and is associated with the meditative state. The meditative state can also be cultivated without having to close your eyes. So, for example, if I ask you right now to check which nostril is more open, or which hand is warmer, or where your tongue is in your mouth, notice that you actually didn't have to do anything physically. So this is the quiet direction of attention, the deliberate direction of attention onto internal experience. And this is the essential ingredient that we call mindfulness and gives us the ability to begin potentiating whatever else we do in psychotherapy. I might add that mindfulness is essentially based on one central ethical principle in yoga called satyagraha. It means being with the truth, being as you are. And so there isn't anything you really need to do. It's just a matter of including yourself in the picture. In therapy, when you turn your attention to your internal physical, mental, and emotional experience, you automatically are directing yourself towards a healing experience. So the next digit is this index finger, which is kind of the egoic finger. It's the finger that we use to direct. We say, I'm in charge, I want this, we point. And what this represents for me in the psychotherapy process as a principle is the understanding that it is the client who is in charge of their healing. And this is based on one of the other ethical principles in yoga, as well as the Hippocratic Oath, which is do no harm, which means as a therapist, I understand that I can't force somebody to change or to make improvements. And so as a therapist, my stance is not only to be meditative, but to not impose, to not try to make the change and recognize that the person themselves is in charge of their healing. So then the remaining 3 fingers actually constitute one other principle, which I call systems theory. Systems theory is not an easy concept to understand, but we actually all do. If you think of a Calder sculpture, those of you who look at art, or most of us can remember the kind of mobiles that we had hanging from our offices or our homes, where there's a string with a weight suspended on it, and attached to it is a bar, and attached to that bar are 2 other strings that drop down to 2 other points that then again have other points attached to them. So there's a whole system of weights and balances. And if you touch any one item in that mobile, every one of the other items and the entire system is going to have an effect, is going to change or move. So when we think about these 3 fingers, to me they represent thoughts, emotions, and behavior. And I see them as all interrelated, and particularly when you have mindfulness and when you have ahimsa, non-imposition, you can turn your attention to the interrelated pattern of these three phenomena that we all have in our experience. I want to go a little bit further because systems theory says that these elements are not only related within the person, but outside of the person. So let me talk a little bit about what's going on within the person. We think of it systemically. Everyone knows that when you have a very strong emotional feeling, there's a physical component to it. And the reverse is true also. When you have very strong physical sensations, I work with people who have chronic pain and chronic illness, very often their thoughts and their feelings and their behaviors are following a pattern that's generated in relationship to that pain. So in the therapy that I practice, I try to engage all of these levels of experience in the dialogue. The physical level of our experience can often tell us something about what the language that we need to express what we're emotionally feeling. And it can also give us clues as to the way in which your body-mind wants to protect or defend itself or what it needs. So that's systemic thinking from within the person, which I encourage when we're doing the therapy process. But there's also another level of systems theory that's important in my understanding of the way I work with my clients. And that is that I am not separate. I am not a detached, neutral observer separate from the therapy process. So as a therapist, I try to stay very engaged. And I might add that as a result of this, one of the most rewarding aspects of my experience in the role that I sit in is that I have a chance to understand more and more what it's like to be a human being. I am joining and connected with my clients in their struggles, in their learning, and in their accomplishments.